First, we'll start with type 1 diabetes. Out of the three, type 1 diabetes, LADA, and MODY, type 1 diabetes is by far the most common. This is an autoimmune disease where the immune system attacks insulin-producing beta cells in the pancreas. It usually starts in childhood or adolescence, but it can develop at any age. People with type 1 diabetes need insulin for survival. They have an insulin deficiency after they get through their honeymoon period and their body is no longer making insulin. The honeymoon period can last about 6 months to 2 years. Diagnosis of type 1 diabetes is confirmed with high blood sugar, low insulin, and low C-peptide levels. C-peptide is a molecule that's released when our body produces insulin, and so if that C-peptide is negative, it means our body's not producing insulin on its own. LADA, or latent autoimmune diabetes in adults, is sometimes called type 1.5. It's also autoimmune, just like type 1 diabetes, but it develops more slowly and usually shows up in adulthood, often after the age of 25 to 30. At first, people may not need insulin and are sometimes misdiagnosed as having type 2 diabetes. Over time, as more beta cells are destroyed, insulin is required. The key test is finding autoantibodies in adults who don't fit the typical type 2 pattern. Now, the last category is MODY, and this stands for maturity onset diabetes of the young. Now, MODY is very different. It's a genetic form of diabetes caused by a single gene mutation that affects insulin production. It usually appears in adolescence or early adulthood, and it's often mistaken for type 1 or type 2 diabetes, but the family history pattern is a clue. There are multiple subtypes of MODY, and treatment depends on which gene is affected. Some forms respond well to oral medications like sulfonylureas, while others may not need much treatment at all. As an overview, type 1 diabetes and LADA are autoimmune in origin, while MODY is genetic mutation.